This is what I mean by comprehensive coverage. The plan covers every aspect of your medical care, including many services that private insurance does not routinely cover. Is Medicare in financial trouble? Well, there's no simple answer, but you can see from these newspaper clippings that politicians have used scare tactics about Medicare going bust for the past 50 years. Well, let's face it, our elected representatives tend to favor wealthy and corporate interests, but they don't mind slashing Medicare and other social programs and calling that fiscal responsibility. Then they spend the money on things like wars and tax cuts to the wealthy, and then they claim that Medicare is in grave financial trouble. Well, whether Medicare is in trouble or not depends strictly on how our representatives in government feel about supporting the elderly. It's certainly true that Medicare's costs, like everything else in our economy, rise every year. But let's look at the facts. To begin with, Medicare services the oldest and sickest people in our population, leaving the young and healthy to be served by private insurance carriers. So naturally, costs per patient for Medicare are much higher. Secondly, over the past decade, the cost of private premiums has increased about 12% a year, as shown here, while the cost of Medicare has only increased about 4.5% a year. Third, our tax dollars subsidize Medicare Advantage plans and the Part D pharmaceutical plans. Now, this is money that could be used much more efficiently to improve and expand traditional Medicare. In fact, Medicare is actually one of the most stable and efficient parts of our entire healthcare system. So, why are our healthcare or health insurance premiums going through the roof? In this picture, the blue bar shows how the number of doctors in the U.S. has increased since 1970. And the red area is the increase in the number of for-profit administrative personnel. So if you're wondering where the money goes, well, sadly, it's right here. This bar chart directly compares the efficiency of private insurers with the traditional Medicare system, a system which has been in operation for more than 60 years and devotes 97% of income directly to providing health care, compared to 69% for the private industry. One of the biggest factors in rising costs is the use of premiums for things that do not provide medical services. Here are some of them. Now, you should note that the percentage depicted here does not include the additional billions that doctors and other providers have to spend to hire and maintain huge clerical staffs just to bill the thousands of private companies, each with its own set of complicated forms and rules. So your doctor is often faced with a nasty choice. Either she passes the extra cost on to you, or makes up for the loss by seeing a greater number of patients per day, meaning less time to spend with each patient. So just in case you were wondering why your doctor can only spare 15 minutes at a time for you, well, you tell me, is this any way to run a healthcare system? Now, here's only one place where the money is going, and it's into the pockets of private insurance company executives. For example, Steve Hemsley of United Healthcare gets paid $13.2 million a year, which is about $6,600 an hour. Ronald Williams of Aetna makes $11,000 every hour, plus another $32.8 million a year in stock options and retirement. Meanwhile, people are literally dying from the inability to buy the health coverage that these CEOs and their companies are supposed to be providing for Americans. This is just wrong. Now, if you've been having a tough time paying your mortgage, you could easily end up losing your house. Medical debt caused half of the 1 million home foreclosures in 2008. This can't happen under single payer, because the government pays for the vast majority of everyone's health care needs. The cost and the risk are spread out evenly over the entire population of the nation. This means no more huge medical bills, no problems with the mortgage, and therefore no foreclosures. The same story applies to bankruptcies. The greatest single cause of bankruptcy in this country is medical debt. Ironically, the majority of people who went bankrupt due to medical bills had private insurance coverage. Once again, under a single-payer system, this can't happen. Our businesses are at a severe disadvantage in competing with businesses based in countries with single-payer health care, because our competitors don't have to pay hefty sums for health insurance for their employees. Here's an example. American car manufacturers have to add more than $1,000 worth of health insurance costs to every car that they build. Even a Japanese car made in a U.S. factory costs more than the exact same car made in a factory in Japan. So obviously, single payer would help discourage outsourcing of American manufacturing and other jobs overseas. Repeated analysis by the Congressional Budget Office, the GAO, and other independent agencies over the last 20 years shows that switching to a nationwide single-payer system would produce a substantial savings, as well as many other benefits. It would cover everybody with fully comprehensive benefits. It would give complete freedom of choice. It would have universal access. All that, and it would still produce a net savings. You're probably wondering how a single-payer system might affect you personally. Well, let's look at it. First of all, you would have no premiums or deductibles, or co-pays. There would be no lifetime caps on your insurance. You couldn't be excluded because of a condition you already have. In fact, nobody is excluded from a single-payer plan from the womb to the grave. Even the costs of your auto and home insurance will be reduced because single-payer eliminates the need for medical liability coverage. You're covered for every medical need. And you can use any doctor, any hospital, any provider, anywhere in the country at any time. We did say before that health insurance puts our businesses at a disadvantage with foreign competitors. Well, the employer who currently provides insurance will have a significant savings, probably including everything on this list. Even those employers who do not currently provide insurance will have reduced liability and insurance costs, and auto insurance costs, and greatly reduced workers' comp costs, and many of the other things listed here. Furthermore, small employers will be able to compete for workers on a more level playing field because prospective employees will no longer have to take a job with a larger company just for the health benefits that the small company can't offer. Now, the big issue on the tongue of every politician and insurance industry spokesman today is how much will it cost to revise the system? So you remember the slide showing how much we're paying now with our for-profit system? $2.4 trillion a year. By comparison, universal single-payer would save more than $400 billion of that, even while extending full comprehensive coverage to every American. How is that possible, you might ask? Well, for starters, because private health insurance companies are so inefficient, we can save more than 20% off the top simply by removing the wasteful overhead in the current system. The first bar shows what their administrative costs are. Now, as you can see in the second bar, the public option, as currently structured in Congress, would save very little over our current system, maybe $50 billion if that. That's because it still has to pay private insurance companies with all of their waste and inefficiency. By contrast, single-payer brings the total overhead down to less than half that of the current system. And it cuts the insurance portion to less than 30% of the current system.